All right, I think we can go ahead and get started. Okay, let's go ahead and...
Hello.
Hello.
I'm unmuted finally. Yay.
Okay, we're all here.
So I think we are all ready to start. I think we have quite a few people participating today, so that's excellent news. All right, so hello and welcome to Listen In with ICM. I'm Ross and I'll be your host today. Today we are going to be discussing the importance of vitamin D in our overall health. At the bottom of the screen, you should see the Q&A section. You can go ahead and ask your questions there. We probably will not be able to get to any of the answers today, but what we'll do is we'll go ahead and save those questions, and we're also recording today's session. So we're going to put those on the website, on the blog, as well as the questions and the answers from the doctors as well. I'll send out another email later on in the week when that is all completed, so you can go ahead and see all of those as well. Today we have Dr. Genevieve Courtney, Dr. Kim Celmer, and Dr. Jancy Karp. So if you can go ahead and take it away, Courtney.
Okay, great. So today we're talking about vitamin D, and I wanted to talk about vitamin D because you may have noticed it's been in the news quite a bit lately. So so I had this big want to just talk to you all about why it's been in the news and why vitamin D is so important and why most people really should be on vitamin D and get their vitamin D tested. So I have a little presentation that we're going to go over here. So I'm going to go ahead and share my screen in order to do that. Let's see. Are you seeing my screen now?
Yes.
Okay, great. Let me make the slideshow big. All right, great. So, and there I am. And I wore the same dress today, so I matched my picture because I thought that would be fun. Okay, so first thing is, where do you get vitamin D? A lot of us think of vitamin D coming from milk, and yes, you can get fortified vitamin D milk, but the main place you get vitamin D is really from the sun, but you can get it from foods, and some foods naturally contain vitamin D. And so I listed some high vitamin D foods here, and I thought it would be kind of fun to see if Dr. Celmer or Dr. Karp wanted to guess how much is in these different foods, because it was really interesting to me and something that I didn't know. And so I looked it up. Do you guys have any?
I would say not a lot in any of them. Because
Yeah,
I
would agree.
My patients, you know, what we're trying to do is close to impossible getting the numbers up by just food.
Yeah.
So,
Say the exact same thing. Yep.
Mhm.
Even in the sun in the Pacific Northwest, hard to do that as well.
Yeah, definitely. And typically I think of vitamin D in Seattle, people needing about 2,000 IUs a day of vitamin D, but it varies person to person. But the RDA of vitamin D for the US or for the world is only between 600 and 900. But since we live so far north and we don't get much sun, it's definitely important to get a little more. So these different foods in here, they're really quite minimal, and we're trying to hit that 2,000 a day. Cheese, for example, is listed a lot of places as having a lot of vitamin D. It only has 7 IUs.
wow.
Yeah, eggs have 44. Now fish can have a bit more. And so if you're eating 6 ounces of salmon, you'll probably get like 700. And so it can be quite a bit. The same thing with mackerel. Tuna is a bit lower. It's more like a little over 100. But the cod liver oil can be a good option. That does have over 1,000 per tablespoon. And so if we're trying to get 2,000 a day, you could potentially get it that way too. Most vitamin D, there are the 2 forms of vitamin D, the D3 and the D2. Usually we recommend D3. It's been shown to increase the blood levels of vitamin D a bit more than the D2. And we don't have any D2 in our office.
No.
That's usually prescription. When
Yeah.
you get a prescription from a pharmacy, it's usually going to be D2.
Yeah, and I guess it's easier to or cheaper to produce the D2.
It is, yeah.
And what are the actual names, Genevieve, of D3 and D2? What are the words that we use?
You mean calciferol? I can't say it very well. Yeah. Mm-hmm.
Yeah, so there's ergocalciferol and cholecalciferol.
Yes, yeah, cholecalciferol. Yeah. So, so when we think about the sun, I was wondering like how much vitamin D do you actually get from the sun? So I did find a study where they did this in one of the Scandinavian countries, and so that'd be pretty similar to us in the summer. And they showed that after 30 minutes of sun, you got between 10 and 20,000 IUs of vitamin D in the summer. And so, so definitely, yeah, in July, August, you're going to be getting some from the sun here pretty quickly. And you can store it up for months in your body for up to 3 months. And so you can get quite a bit from the sun in the summer. But I'll go to this because the thing is, you don't get it very much the rest of the year in Seattle. The issue with that is, I mean, just like yesterday and today, I mean, we're not seeing the sun. It's just sort of dusk all day long. And the sun rays, UVB sun rays is where you get vitamin D. And because we're at an angle, so angles far north, those UVB sun rays never actually penetrate enough for us to be able to make vitamin D in the skin. So I found a study where they talked about this at the University of Washington, and they said all the way from September to early June. So that's like 10 months out of the year, we don't get enough UVB sun rays in Seattle to make vitamin D in our skin. So I think sometimes we forget how far north we really are. Seattle is the northernmost US city of at least 500,000. We are further north than many Canadian cities, Toronto, Ottawa, Montreal. We are really far north. And so sometimes we don't think of that because we look at maps flat and we don't look at a globe, but we are really far north. And so if you think you can get vitamin D from the sun in Seattle, you really can't. You are going to become deficient in it eventually in the winter time if you're not taking it or doing maybe one of these very high vitamin D specific diets and being really careful about it, or leaving Seattle. But this year we're not leaving Seattle, we're here because of COVID. And so this is an important thing to think about. I don't know if you guys have more to add on it.
Well, Genevieve, can you just talk to the idea of sunscreen and being out in the sun and your vitamin D in the summertime?
Yeah, I mean, I found some conflicting information on this because there's the UVA and the UVB rays, and the UVA rays is what causes you to be tan. And so it's interesting, you can get tan without making vitamin D in your skin. And so so I'm not sure how with sunscreen, I think it can vary sunscreen to sunscreen, how good they are at blocking the UVB. And so that was the information I could find, is it seemed like depending on the ingredient in the sunscreen, some of them do block the UVB and some of them don't.
Okay. So that 20 to 30 minutes of being exposed to the sun, if you're wearing sunscreen that blocks UVB, there's a chance that you might not be getting as much vitamin D as we're talking about.
Oh yeah, definitely. Yeah. If you're wearing clothes and your skin covered, all of those things are going to lower that.
And I have a question, Genevieve, about a couple things. So in the study about the sun exposure, for 30 minutes, did they talk about how much skin exposure you really need? Is it a small amount of skin exposure? Is it a large amount?
They didn't say. It just said like of normal summertime exposure is what they said, something along those lines. Yeah.
And the other, okay, so we don't really know, but I for some reason I thought I read somewhere you need quite a bit of your skin exposed. Like, this is a tank top and shorts sort of thing.
Yeah. And
the
that's probably why the wide discrepancy of 10 to 20,000 in 30 minutes is that.
It really could be. And then the other thing, I had a question about is the amount of melanin in the skin and the time. I think that there's an issue there too. Did you read anything about that when you're
Yeah, that's a good thing to bring up. And yeah, the darker your skin tone, the more the UVB rays are going to be blocked, and therefore you're going to have even a harder time making vitamin D. So if you do have darker skin tone and you live in Seattle, you're going to have a really hard time making vitamin D. And so that's something to think about, and yeah, reason to take it and to be tested for it.
Great.
All right, I'll go to the next slide here. So there's kind of three big reasons I always talk to patients about why you need vitamin D. The first one is bone health, and the second one is mood and energy, and the third one's immune system, which I have that one bolded because that's something that we're kind of all wanting to talk about, I think, right now, is our immune health. And so I'm going to go into that one in detail, but I figured I would briefly discuss bone health and mood and energy. Typically with bone health, how we think about this is if vitamin D is needed in order for you to actually absorb calcium. So if your vitamin D becomes quite low, you actually won't absorb calcium very well. And that can lead to eventually having bone thinning over time. So it's definitely really important for that. Do you guys want to add anything to that?
Not necessarily, other than, if anyone's ever heard of this, very uncommon disease in these days, but it's, many years ago or generations ago, there was something called rickets that children would get in it, and they had these, deformed, bendy bones, and it was really vitamin D deficiency that these children would be getting, and they weren't able to calcify their bones, and so they had bone deformation. So that's a very sort of often well-known condition that's linked to severe vitamin D deficiency in a developing child, but that's kind of on the very severe end, and just kind of illustrate what that's about. But definitely, I see a lot of patients with osteoporosis, and it's a big issue to make sure that we have plenty of vitamin D so that calcium can be absorbed. Yeah.
Right, to support that bone density. I think that's a great point, Genevieve.
Mm-hmm. Yeah, and another thing, when you absorb that vitamin D into your bloodstream, then if you don't have enough vitamin K, then vitamin K is what actually allows the body to move the calcium from the bloodstream to the bone. And so it's important that the vitamin D that you're taking has some vitamin K in it. Otherwise, if you don't have enough vitamin K in your system, you can actually form calcium plaques in the heart. And so it can be bad for heart health. And so all of the vitamin Ds we have the vitamin K in it, and many other ones do other places.
Yeah, definitely a great thing to look for in terms of what you're buying, because a lot of times they're now combining them to support that. So that's great to point out.
Mm-hmm.
Yeah, and where do you get vitamin K in your diet, Genevieve, real briefly?
Greens. Yeah.
Basically, yeah.
That's how I think of it.
Leafy greens are going to get some vitamin K, but potentially maybe not enough. So
yeah,
put it in with the D.
Yeah. And then mood and energy, this is something that I think we all talk about with our patients a lot, but a lot of times people think of vitamin D deficiency as kind of being silent and people not noticing that they have it, but sometimes people do notice that their energy or mood goes down when their vitamin D goes low. And one of the reasons for this is that your vitamin D is needed in order to produce serotonin. So serotonin is that happy hormone. And it's something that a lot of antidepressant medications focus around, is trying to increase serotonin in the system. And so some people do notice that if their vitamin D levels are optimized, that they notice more mood, a better mood, and more energy. Do you know of other things that you explain to folks around that?
I mean, I just see a big change in terms of mood. Yeah, just an overall sense of vitality. And that connection between low vitamin D and seasonal affect changes, or SAD, that people call, because as you're saying, in Seattle, in the Pacific Northwest, that reduction in sunlight, reduction in making vitamin D, and the mood changes that many people here notice or suffer from as it gets darker. So addressing those vitamin D levels, but I have seen a significant change in mood and overall just sense of like wellness and vitality in patients. And sometimes they just don't even realize it until their levels increase.
Yeah.
And usually, I've seen it, dramatic for some people, they absolutely notice, but most of the time it's a little bit more on the subtle level. It's this kind of low level improvement. So I wouldn't say in my experience with patients that they get their vitamin D levels up and they're like, oh my gosh, I feel amazing. But it's this is really underpinning of this just general sense of wellness that's a little more quiet for most of my patients, but it's there.
Yeah. Okay, well, now we'll go more into the immune system. We talk about this a lot with our patients about vitamin D being connected to the immune system. I found some specific studies where they talked about this. And so I just wanted to read those to you. So these are either headlines of different studies. I have the link at the end of the specific studies if you're interested in. So one is deficiency in vitamin D is associated with increased autoimmunity as well as increased susceptibility to infection. So both deficiency linked to autoimmunity and infection. The next one is laboratory studies show that vitamin D can reduce cancer cell growth and help control infections and reduce inflammation. So now we have it also linked to cancer potentially and inflammation. And then the last one is studies provide evidence that vitamin D deficiency may confer increased risk of viral infections, and such as influenza, respiratory tract infection, and human HIV. So with all of this information about vitamin D being connected to your immune system, obviously people right now with COVID going on are really looking at vitamin D and how vitamin D could be potentially helpful with COVID. And so there's just a lot of talk around that, and it's just really in the news right now. It's something, vitamin D in the immune system is something we talk about with our patients a lot. People who have autoimmune diseases or a family history of autoimmune disease, folks that are sick will often recommend a high dose vitamin D for a period of time. So it's something that's just really commonly spoken about in our practice. Do you have more to add around that?
Well, certainly, I mean, there are some, even more specific, indications on vitamin D linked to, risk for MS. And then certainly the Pacific Northwest is a hotbed for MS. So that's one specific autoimmune disease that we know has a pretty good link in the research. And also there's some links with breast cancer. And actually, I recently read an article linking serum levels in subjects of vitamin D, lower serum levels associated with increased incidence of colon cancer. So we see some of these things trickling out in the research for specific cancers and other specific diseases, definitely. And do you have any mechanism by how vitamin D affects the immune system function?
I don't know. Yeah, I don't know mechanistically. I know that there's some changes in white blood cells that can happen with vitamin D and white blood cell as part of the immune system. But beyond that, I'm not sure.
Yeah, I know it can upregulate the natural killer cell activity, which are obviously going to be your big battlers at an onset of an infection. I'm not familiar with the anti-inflammatory effect that it has on a mechanistic level, but I know that it can affect the natural killer cells.
Yeah. So like I said, since all this information was already out there pre-COVID, this has kind of set the playing field for a lot of researchers to be really looking into vitamin D right now. So I just wanted to talk about that before we kind of talk about it, that COVID is new, so research is not yet conclusive. So as you know, it's kind of been a moving target with COVID-19. And so we kind of have to take everything with a grain of salt. So although these things that we're talking about around vitamin D and COVID are interesting, there's other reasons people have higher vitamin D, people who are more active, people who get outside more, and those tend to be people who are just overall healthier in general, people who are aware of their health more and who are taking supplements. And all of those folks are going to have higher vitamin D levels naturally. And so there is this big confounding factor. So the current research is just really in its infancy around vitamin D. And vitamin D as with everything except for remdesivir now has been approved, but it's vitamin D has not been approved for the treatment or prevention of COVID. This is more just kind of interesting things to look at here. So with that said, there has been quite a bit of research going on around COVID. So I found some different articles talking about this. So evidence that vitamin D supplementation could reduce risk of influenza and COVID infections and death. And this was from a specific peer-reviewed journal called Nutrients. This headline has been everywhere. Study finds over 80% of COVID-19 patients have vitamin D deficiency. So I found that headline, just about everybody's talking about that one. And then everyone's asking the question, can vitamin D protect against the coronavirus? And so this was on the Mayo Clinic, they had a write-up about that. So this is just really big in the news and why I wanted to talk about vitamin D today. So I had one specific study that I found. There's lots of studies out there, but they're all really small and they're all really new. But what this is where they took some patients and that were in the intensive care unit who had COVID-19. And so these are people who are quite sick with COVID-19. And they either they put them in one group where they treated them normally and without vitamin D, and in the other group they gave them vitamin D. So let's see. Out of the 50 patients treated with vitamin D, oh, I'm sorry, it wasn't ICU. They were already in the hospital and they're seeing if they go to the ICU. I'm saying it wrong. So they were in the hospital, they're seeing if they went to the ICU. So out of the 50 patients treated, one required admission to the ICU. And out of the untreated patients, 13 required admission. So the people who weren't taking vitamin D had a lot higher admission rate. And they talk about the odds ratios and how this was significant. And then later on, they talk about how of the patients who were treated with the vitamin D, none died, all were discharged. And of those who were not treated with the vitamin D, let's see, were not admitted to the ICU, were discharged, 2 died. So this is really small. I mean, it's only 50 patients, but that's what we're seeing now is that a lot of hospitals, especially like learning institutions, are doing these small studies on vitamin D. So hopefully in the next couple of years, in the next year or so, this data can be put together and be more significant, be more than 50 people in it, but it's looking kind of promising. And there's other reasons to have your vitamin D be optimized beyond just COVID that we already talked about. Do you have anything you'd like to add before I go on?
No, I mean, I would say, would there be, I just don't see any harm in making sure that your vitamin D levels are optimized. Mm-hmm. And then even in the light of this, I mean, it just makes more sense. Maybe you do have a little bit more peace of mind that, okay, my vitamin D levels are looking good, doesn't mean you wouldn't obviously do all the precautions you would really want to do, but it is worth really considering that as another reason to make sure that they're really optimal.
It's an extra layer of support and a barrier for your system.
Mm-hmm.
Yeah. So the other reason why I wanted to talk about this, so this slide says, what can you do? There's been an issue with some insurers not covering vitamin D testing. And we know which insurers there are, and it really varies lab to lab how much they charge for vitamin D. Some labs are like $250 and other labs are around $25. And so if your insurance doesn't cover vitamin D testing, we can order it through a lab that's less expensive. So you're not on the hook for a $250 bill, it's only $25. But there's been some barriers to some patients in our practice getting their vitamin D tested because of insurance not covering it. And so I know that I have patients out there that haven't been tested for vitamin D, and I'm sure you guys do too. Mm-hmm. And so we just wanted to make sure that we let all of our patients know that we have options of different labs. and we'll work with you and look at your insurance and figure out what's going to be the best the lowest cost for you. And the other thing is if you're going to be getting labs done, we'll look at other labs that are appropriate to be ordered and other ways to optimize your health. So so if you're interested in getting your vitamin D tested, I would recommend setting up an appointment with your provider. We're doing video visits. Those are covered by insurance right now. Then you can go into the lab either here or at a different lab. We're being very careful about folks coming into our lab and how we clean and sanitize and have few people in that area. And I know LabCorp is doing the same. So, and we can get all of your labs drawn at once. So I definitely would suggest if this is something that interests you and you want to get your vitamin D tested, then make an appointment with your provider for a video conference to discuss. If you're feeling nervous about going to the lab, especially with the new stay-at-home or more stringent stay-at-home orders in place, I would still recommend having an appointment with your provider to discuss how much vitamin D are you currently taking. Look at what you're doing overall to optimize your health this winter, because it's just every winter, all the time, it's important to optimize your health, but now it's really coming to the forefront of people's minds to make sure to just really be taking care of yourself. And so still worth having a video visit to discuss that. Do you have anything else to add to that?
No, I mean, I think, you know, when we talk about labs that won't cover vitamin D tests, they will, but there's very few conditions for which they will. And it's some of these bigger payers that we know of, and they've sent us letters basically saying we're not going to pay for a vitamin D test unless this patient has a documented bone disorder. So they wait until you've got osteoporosis before then they'll allow you to have a vitamin D test. And it doesn't even matter if you have a past test that showed that you were low. It's still not a good enough reason. So that's really what that's about. And I'm not sure why they made that decision. I think they just think people should just take vitamin D regardless of what the level is. But really, you know, there's some things about vitamin D supplementation that makes it sometimes unique to different patients, whether or not they have some ways in which they have difficulty absorbing or assimilating vitamin D. And there are some people that we really have to push their vitamin D levels just to get to those optimal numbers. And other people, we really don't need to do a whole lot, and they're pretty good at storing that up. So that, and vitamin D can be a toxic vitamin. You don't want to just take loads of it because it can build up in your system and you can get overdosing of vitamin D. So that's really some of the important factors around why you should probably know that number.
Know your baseline. And
you know, your doc could talk to you about, okay, if there was no way to get a test, and you know, what would be the minimum thing for that particular person that would be reasonable, you know, and at least give them some level of support.
The other thing I just want to point out is if you are already taking vitamin D, just make sure you're taking it in the presence of some fat or oil, because vitamin D is a fat soluble vitamin and it needs to be in the presence of that to be absorbed. So a meal that's got some good oil, avocado, nuts, to help with that absorption. Yeah,
you're not going to absorb it very well if you take it with a cracker. I mean, you will a little bit, but you know, you're better off having a full meal that usually will have some fat in it.
Yeah, so that was all that I had here. These are just the references of the few articles that I talked about there. And we hope that we hear from you guys about getting some vitamin D labs done. And yeah, is there anything else that we should say before we sign off?
Well, I think, did we have some, Ross, were we going to go over some Q&A, some questions? Like, were you going to ask us some of the questions that came up that we might need, that we didn't answer in the webinar?
Yeah, we can if you guys have time. I don't know what your guys' schedules are like.
I think a couple minutes. Why don't we go through a few that seemed interesting questions that we didn't really cover?
Okay, I think this one's pretty good. So the first question is, how do you balance benefits of sun for vitamin D with need for sunscreen?
Yeah, well, one thing is that, like I was saying, it's only 30 minutes of sunlight that was shown to give 10 to 20,000 IUs of vitamin D. And so that's pretty reasonable amount of time to be out in the sun. And then after that, you could definitely apply on some sunscreen. And most folks aren't going to get sunburned in that amount of time in the Pacific Northwest. So I think that that'd be a reasonable way to look at it.
Okay. How do I know if I'm getting too much or not enough vitamin D? Does the brand of vitamin D matter?
Really the only way to know if you're getting too much or not enough is to get your lab done. I mean, unless you're taking 0, then we could probably assume you're getting not enough. And if you're taking some very huge amount, like 50,000, we can probably assume you're getting too much. Otherwise, it really is getting your labs done. Now, as far as all supplements go, they do vary and quality varies. We definitely recommend getting supplements that are third-party tested. And I don't know about specific supplements and absorption of vitamin D themselves. I don't know about information about that, but definitely making sure it's a D3 with K is important.
All right. I believe that we answered the one of how much skin must be exposed to make 10,000, 20,000 IU vitamin D in 30 minutes. I think you did go over that a little earlier. Is there a difference between the quality between vitamin D in a capsule and vitamin D in food? Should we try to get in food?
Yeah, well, it varies. The vitamin D in food can be, depending on the type of food, can be either D3 or D2. I don't think I think eating fish is a good thing for a lot of reasons. And so it's reasonable to eat fish regularly for many reasons. But I don't think we need to really push vitamin D in food.
And I think to get a therapeutic dose of vitamin D, it'd be quite hard on a daily basis to get it from our food.
Yeah, living where we live.
Yeah, I think we're just in that unfortunate, situation where we live. I mean, just the further from the equator where you are, if south or north, that it just becomes an issue.
Well, unfortunate for vitamin D, Dr. Celmer. It's
Well,
a beautiful place
it's
to live.
unfortunate that we can't just lay out in the sun and get our D every day. We have to swallow it, because I think the natural way, right, that it happens typically is we make it.
Mm-hmm.
We just don't have the opportunity to do that.
Just have to go out on a hike every day in the summertime in your tank top and shorts, and then you'll be good with vitamin D for that period of time.
Every single day all winter, which is probably what Native folks did, right? In these further north places, they did eat fish every day, and that's why, yeah, they were okay.
Exactly.
Mm-hmm.
What about age and the body's ability to make vitamin D3?
I do know that with age, the RDA of vitamin D does go up. I don't know if that's because of the body's ability to make vitamin D from D3 from D2, that they have that increased amount in the RDA, or if it has to do with absorption of the vitamin D itself. But I do know it is recommended to get, it's about like 20% more for those over 70.
Okay, let's see here, where to go? Do happy lights provide vitamin D? I'm guessing meaning something like this.
Yeah, the happy light. It depends on if it's making that UVB ray versus that UVA ray. And I think some of, I think the happy lights are more focused around UVA, is my understanding.
I'm not sure, but I know there are products, there are lights out there that do give the UVB for vitamin D production. And I don't know of any, I'm sure you can search them on the internet, but they do exist. Mm-hmm. And you can get that. And I don't know if we talked much about where vitamin D comes from for supplements.
No, I don't know about that.
Well, vitamin D, your classic vitamin D comes from lanolin, which is wool oil.
Right.
And so, technically it is not a vegan product. There are vegan forms or vegetarian forms of vitamin D supplements, and those are coming from mushrooms. So that is one food that actually can create vitamin D, one plant food that can create vitamin D if exposed to the right kind of light. So that's where your vegan forms of vitamin D come from. It's a mushroom base, but pretty much all non-vegetarian. If you see something that doesn't say vegan or vegetarian, it's coming from lanolin.
Okay, are we still good on time?
Yeah, I think maybe do 2 more questions and then we got to probably sign off.
Okay. Can taking vitamin D supplements cause diarrhea?
I haven't seen this in folks. Definitely some
I haven't
of them,
either.
Yeah, I haven't seen it. Some of them are in an oil capsule. So I guess if you were having a sensitivity to the oil that it was in, but yeah, I haven't seen that.
I have not seen that either.
I haven't, you know, I would expect there's something else going on that would make someone sensitive to D in that way, if that was happening for them, and they would want to talk with their practitioner about that.
Mm-hmm.
Okay, and then the last one is a kind of a two-parter. How much IU dose per day for adults? Does the dose I will need to take depend on my body weight?
Well, yeah, so it kind of depends person to person. I mean, like we said earlier, we usually think of 2,000 IUs a day for folks in Seattle, but really there's a variety of reasons why you might need more or less. How you're absorbing it, how much sun you get, what color your skin is. And so it can vary person to person. And so really, I think having an appointment with your provider to get some labs done, and we can order other labs that are appropriate for you, would be a good next step.
Yeah, I think that comes down to the emphasis on really knowing what your levels are so that your provider can make a recommendation appropriately for you as an individual. I don't believe there's really a direct correlation or a calculation like this is your body weight, so this is how much vitamin D. It's more based on what are your levels, what are we targeting to get towards, and how can we get you there.
Mm-hmm.
All right, awesome. Well, those are all the questions that we have time for. Like I said, I will go ahead and put the recording of this video on the website, as well as all the questions. I'll send all the questions around to the doctor so that they can answer them, so we have full answers to every single question. I'm hoping to have this done by Friday. If not, it will be the coming Monday. We'll have the video and those questions up on that website, and then I'll send an email out to everyone, letting them know that it's all available for you.
And thanks for doing this, Genevieve. This is great.
Yeah, great job, Dr. Courtney. Thank you.
Yes,
Thank you.
Right.
Thanks, Ross.
Bye-bye, everybody. Right.
Bye.
Bye.